I'm really pleased to say that we have an interview with um, Dr. Elmar Joura, who is an expert in the area of HPV vaccination and vaccination in general as a gynecologist working in Vienna, Austria. Elmar, welcome. It's lovely to have you here.
Thank you.
So, my name is Professor Raman Bedi. I'm the president-elect of the World Federation of Public Health Associations. And we, as the World Federation, are very keen on promoting a call to action for adult vaccination of HPV. Howie, you have been working for over 20 years in this area, and I wondered whether you could just give us a little bit of a background of the type of things you've been involved with and the type of work that you're engaged with at the moment.
Well, I've been involved in HPV patients since the start of my career, now more than 30 years ago. And at that time, we didn't even know about the existence of human papillomavirus, and I've been involved in various vaccine trials since 2001. And I'm working as a gyne-oncologist and seeing patients with HPV-related cancers every day.
That's very good. Thank you so much. And HPV vaccinations is well known for young people and particularly young girls. Is it really effective for adults?
Uh, it is. So when we look at population-based data, we clearly see the earlier we vaccinate, the more effect we get. And if you are designing a program, it pays off to have a young age for vaccination. However, uh, in Europe, we don't have any upper age limit in the license, so we can vaccinate at any age, and the vaccine has the potential to prevent new infections and following also future disease at any age. And if you vaccinate at a young age, you have the lowest risk and you stay at this low risk. But since most of the infections are cleared by the immune system, you can prevent later in life everyone against new infections. And it's not only about disease, it's also about positive screening tests. So abnormal HPV tests, abnormal pap smears, which cause a lot of cost and for our patients a lot of stress. And avoiding this pays off for the individual. So counseling your patients, you clearly can say, take the vaccine at an adult age. Designing a program, you should be as early as possible.
It is possible. No, that's very good. Thank you. There's obviously been some controversy of people who actually have the disease and whether HPV vaccination is any benefit to them at all.
Uh, we have seen in various trials that vaccinated, especially women, so because colonization is such a common surgery that we have most of the data about cervical precancer in that respect, that in observational studies and prospective non-randomized studies, we have a reduction of about two-thirds of subsequent disease at the same site and also at other sites. Recently, there has been a Dutch trial which was prospective randomized, which didn't show an effect in short term, but it's more or less a story of long-term effect. So you have to clear the disease by surgery, and in long term, you get the benefit of the vaccine.
Sure. That's really helpful. Thank you. There's also been some controversy about age limits, and people have used arbitrarily 24, 25 as an upper age limit. Do you consider any age for HPV vaccination?
Uh, so what we do is the Swedish demonstrate to vaccinate up to the age of 30 and to to the HPV test from the age of 30 in women leads to a rapid elimination of cervical cancer. So we give a very strong recommendation up to the age of 30. Then we have data from clinical trials up to the age of 45. So we still recommend it up to the age of 45. And over the age of 45, we have a permissive management. So if our patients say that they want the vaccine, we're happy to fulfill this wish and offer them the vaccine, but it's not an active recommendation. We just let them vaccinate if they want. And as I said before, in Europe it's easy. We don't have any upper age limit, so we can offer the vaccine at any age.
Good, thank you. Now, obviously, the WHO have a great drive to eliminate cervical cancer, and their strategy is well documented, vaccinate young people, screening, and treatment. Do you think vaccination of adults will help us as we try to eliminate cervical cancer?
Uh, the key factor in elimination is certainly a high coverage in the young people. However, what we see in various population-based data, when we have a broad catch-up program, including adult cohorts, then the elimination progress goes much faster than if just vaccinating the young people only.
Good, thank you. Well, can I just say thank you very much? I know this is your lunch break. I know there's patient clinics happening in a few minutes, but we just want to say thank you so much for giving us this short interview. Thank you.
It's a pleasure. Thank you. Kind regards to London.